Welcome to Sugar Daddy's podcast, where we get real about love, money, and everything in between. I'm your host, Namon Jones, here with my co-host, Diopla Sample. What's up, D?
What's going on, Namon?
Man, they say love don't cost a thing, but what about companionship?
Hey, man, we just two grown-ass men having real talk, making real connections.
Welcome to another episode of the Sugar Daddy's podcast. That's right, Sugar Daddy's with a Z. I'm your boy, Big Daddy, here with my homeboy, Magnificent. What's up, man?
What's up, man?
Hey, man, we got a great guest on today, man.
Oh, man, I'm excited, man.
Man, you know, my dad graduated from Georgetown. Our guest graduated from Georgetown.
That's
you know,
it.
He's a Harvard grad, medical school, man, went to Yale for the fellowship. Very, very much intelligent. And what we're talking about today is fibroids. I want to introduce to everybody.
Fibroids and relationships.
Fibroids and relationships. And so I want to introduce to everybody Dr. John Lipman. Welcome, sir.
Oh, it's great to be here.
Yeah.
Thank you. Thanks for having me.
Yeah.
John Lipman has a practice here in Atlanta. He's world-renowned. He's worked with some of the greats that you all have known. Of course, we can mention some of them have gone public, like your Cynthia Baileys of the world, who have dealt with publicly fibroid issues and the issues it's caused in their relationships or marriage and so forth. And so we want to dive into it a little bit today because I believe, speaking with Dr. Lipman off camera, we're talking about the importance of men understanding the health complications when it comes to women and fibroids specifically and relationships. So we're going to dive a little bit into that. How about that?
That'd be great.
Dr. Lipman, tell us why is this important? Why is this important for us to talk about?
Well, fibroids are so common, and they're not only common in all women, but they have a particularly common in women of color. It's estimated that at least 80% of adult African-American women have these benign tumors.
Wow.
So it's very prevalent. So if you're in a relationship with an African-American woman, you might have to deal with these issues that we're going to talk about.
Wow.
So it's a common condition. That's first and foremost. So we're talking about something that a lot of women struggle with. And second, you have to kind of understand what the fibroids are, what symptoms they cause, and kind of how they can affect your relationship. So we'll get into, I guess, all of that.
Well, before we get into that, the question comes to mind. How does a fibroid actually form? Where does it come from?
Well,
Good question.
that's a great question, and I wish I had the answer for you. One of the many health disparities when it comes to African-American women is we don't know where fibroids come from, and the reason why we don't, unfortunately, is we don't spend enough research money on fibroids. I mean, it's such a huge condition. To give you a little backdrop, I mean, there's about $18 to $19 million a year spent on fibroid research, which sounds like a lot of money, but it's
In
nothing.
the grand scheme of things.
Nothing in
yeah.
terms of research.
Yeah.
Okay.
It ranks like in the bottom 50 of the most common medical conditions. And so you take a condition that affects 30 million or so women in this country, with a estimated cost of over 30 billion a year, getting about 69 cents per person affected.
Wow.
So you get 18, 19 million, you divide it by 30 million or so, you get about 69 cents per person affected with a condition that has an amazing, like huge impact in productivity and cost to society. You take another condition that affects primarily Caucasians, cystic fibrosis, which affects about 30,000 people, not 30 million.
Right.
It garners about 94 million a year in research money. So that's over $3,000 a year for a condition that affects primarily Caucasians, and it doesn't have anywhere near the impact that fibroids do. So it's a huge disparity. It's got to end, and there is legislation to try to help fix that, but that's another problem.
Why do you think? Why do you think it's like that?
I think it's pretty obvious why that is. We have a very long history, and I say we, not to put me into there, but previous
Right.
physicians and previous medical doctors, we have a very poor history of treating black women, particularly in the South. I mean, you can talk about Fannie Lou Hamer and the Mississippi appendectomies and the unnecessary surgeries done on black women.
Wow.
And some of that is kind of carries over, and we've got to put a stop to it. And there is legislation, the Stephanie Tubbs Jones Fibroid Research and Education Act, that just sits there, and it does two things. It gives $30 million a year for the next 5 years for fibroid research, which is important. And it also directs the CDC to educate doctors and the lay public on the procedure that we do called UFE, which completely replaces the need for surgery.
Right.
Oh,
Right.
wow, yeah.
I think I was reading something about
Yeah.
that, and I asked you, which is a great segue into, it's urine, UFE, it's urine.
Uterine fibroid
Uterine.
embolization. Embolization means to cut the blood supply off to a certain area. In this case, you're cutting the blood flow to these living fibroids. And without a blood flow, the fibroids die. And as they die, they soften and shrink. And as that goes on, a woman's symptoms go away. So her uterus stays alive. And we've had numerous children born after UFE.
Wow.
But the fibroids are dead and they don't cause symptoms anymore. So you get a woman who's having these horrific crime scene like periods, pain, urinary frequency, the symptoms of fibroids that they can cause, go back to a normal life.
Well, I think that's non-surgical.
Right, no surgery at all. It's
Yeah,
a
that's what I
30-minute
wanted to bring out.
30-minute procedure. Patients go home with a Band-Aid.
Wow.
Where the leg meets the torso, there's like a Band-Aid that goes over where we went in. So there's no surgery, no general anesthesia, no hospital, 30-minute procedure, about a 3-hour recovery at our center, and they go home the same day with their uterus and just a Band-Aid.
I think that's awesome.
It is.
Non-surgical. But Doc, let's go back a little bit. What are the early signs and detections of fibroids? How does a woman even realize or think that she has fibroids?
Okay.
I heard you talk a little bit about some of those things, periods and so forth.
Right.
But can you dive a little bit into it? Because we want you all that's listening in and tuning in to us to really take this serious, because we're going to talk a little bit more about how it even affects relationships, right? So, Doc, can it be prevented? What does it look like?
Well, since we don't know where they come from, but once they arrive on the scene, they grow with estrogen. That's why they can grow rapidly during pregnancy, and why they tend not to be an issue for most women once they reach menopause, the withdrawal of estrogen. So estrogen makes these things grow. And so this is not a condition that you see in children.
Okay.
It's a condition you see in adults. The peak years are somewhere between 30 and 50. Those are the peak years, particularly 30s and 40s. But another point is that African-American women, they get fibroids earlier in life. We've seen some teenagers. They get them earlier. They get them bigger, more numerous. And in the past, it meant that they were more likely to get hysterectomy at a young age. And so if you look racially, African-American women are getting hysterectomies for benign fibroids. Caucasian women are getting hysterectomy for cancer of the uterus, which is appropriate. The average age of hysterectomy is less than 40. These are young women. And I've met way too many women less than 30. I spoke at Tuskegee in front of several hundred young black women. 3 of them came up to me crying after my talk because they had already had hysterectomy in their 20s. They didn't want it, but they were suffering so badly. And eventually you say, okay, if hysterectomy is my only option, I give up, I give in, you win, never knowing about this UFE procedure.
Wow.
Even though it's been available for about 30 years now.
I'm blown away, Doc, because I personally can say I have a niece that's very, very near and dear to me. She's like my daughter, right? And before she hit 30, she had to have a hysterectomy. She had only had one child, but when she hit 30, because she had the fibroid issues.
And what I'm saying is, no matter what your gynecologist tells you, you don't have to have a hysterectomy. Hysterectomy should be the absolute last resort option. UFE works over 90% of the time.
Wow.
So 90% of the time,
90%.
yeah, you'll get the relief you're looking for. That's important. That's why they're coming to see us at the Atlanta Fibroid Center.
Okay.
You get to avoid the risks and long recovery of surgery, because our patients are up walking around the next day. They're back to work in a matter of a few days, not in the hospital for a few days and laid up for 2 months from a hysterectomy. They're up moving about and doing what they have to do. And so you get the relief of symptoms, you avoid risks and long recovery of surgery, and importantly, and often underappreciated by a lot of physicians, you get to keep your parts, you get to keep your uterus, because a lot of gynecologists never tell women what's going to happen to them after they lose their uterus. And again, these are young women, average age under 40, and a lot of them, fair number of them, under 30. So you take a young woman who's losing her uterus, it's going to affect them significantly if they have a relationship at the time or ever in the future.
Doc, I got two questions. One is, has this condition ever been found in any men?
No.
Okay.
So it's a tumor of the uterus.
Okay.
Now I know number of my staff probably think I have a uterus because this is my life's work. I've dedicated myself. They probably think I have a uterus, but I can assure you I don't. But no, this is a condition for women, and it's the most common pelvic tumor seen in women.
Okay. Next question would be, how can a woman who has, she's African American, she has fibroids, but she doesn't have insurance, how can she take advantage of something like this?
Well, she has to try to get Medicaid.
Okay.
I mean, paying out of pocket is hard. It's an expensive procedure, not as expensive as if you went to the hospital and get a hysterectomy, because anything at the hospital is much more expensive.
Absolutely.
But it's still, a costly procedure. And we are one of few specialists that take Medicaid. A lot of specialists don't accept Medicaid. We do. We feel, it's important to do so. And I wish that Georgia would expand Medicaid coverage. I know both our senators are pushing for that. It's money that's available for people in Georgia, but we have so far to this point refused to accept that additional money to fund more more Medicaid individuals that need it.
Right.
So even though it's costly and those things, it's so critical. And I think my next question would answer, your answer rather, Doc, would help our viewers and listeners on why they should come and see you. Or if they're not in this area in Atlanta, you can't come to the Atlanta Fibroid Center, that you could at least go and see your doctor in terms of fibroids. Right. So answer this question for me, Dr. Lipman. Do fibroids kill the sex drive in a female?
It absolutely can. And you don't have to look any further than Cynthia and Peter. Cynthia Bailey was, and I can talk about this because she, as you mentioned, she told her public story. We were on Real Housewives of Atlanta, I think season 6. It was a long time ago. They came in, they filmed the entire consult that we had with her and I and Peter. They filmed the whole procedure.
Wow.
They filmed her follow-up. I mean, so we were part of that journey with her. She was very bold and brave. I mean, here's a supermodel talking about a subject that, some people find taboo that they can't even discuss. Right. I see patients all the time tell me, oh, we don't talk about periods in our family. Well, you really need to do that. It's really important. It's part of the problem that people don't talk about this enough. But to her credit, she was brave enough to, share her story because she helped so many other women. And so her story was, the breaking point, the straw that broke the camel's back, was when she was at a Bravo event in a beautiful white gown. Wow. And all of a sudden, the big gusher hit, and blood literally exploded out of her, running down her legs. And so she realized what's going on. And so she starts to back up into an elevator, her and Peter. And even despite the fact that she's now standing in a pool of her own blood, People are coming up trying to get selfies, if you can imagine, with
wow.
her. I mean, it was just unbelievable, the story she told about this. And it's like, okay, I'm got to do something now. And these fibroids are driving me bananas. I got to get this fixed somehow, some way. And as she describes it, you know, she was offered hysterectomy. She had had children, but, you know, at that point, and she wasn't interested in any future fertility. So a lot of women are told, if you're not interested in children, you don't need your uterus, which is absurd, because losing one's uterus, particularly at a young age, has profound consequences for a lot of women. It can change them psychologically, like a man being castrated. It can change them sexually,
Right.
loss of libido, loss of orgasm, urinary leaking. Next time you go into Kroger or Publix, look and see who's on the package of an adult diaper. Who I think should be on that package should be grandma, grandpa, some elderly person older than me.
Yeah.
That should be on the package.
Wow.
Nope. You'll see a young, attractive African-American woman.
Wow.
Why? Because that's the target.
Right.
Young black women who have hysterectomies now need to wear an adult diaper. In fact, I've got this ridiculous Pampers commercial. Patient sent it to me. It's a full-page commercial for adult diapers. It's this very attractive African-American woman in her probably 40. You see her from behind, and she's scooching on her skinny jeans over her adult diaper, and there's some ridiculous tagline like, "They'll never know your secret." What?
Wow.
Wait a minute, time out. Tell me why that woman needs a diaper. Please answer that question for me.
Yeah.
They don't answer that question.
That is major.
So yes, it can have profound effects. So Cynthia and Peter are struggling as a couple. In fact, the fibroids and the amount of bleeding that was going on almost ended their marriage at that time, because she was bleeding horribly and she was wearing diapers, because that's all that can hold that stuff when it's bleeding that badly. So she's wearing pads, but she needs diapers. She's bleeding out each month way more blood, which contains iron and hemoglobin carries the oxygen around. And so women that bleed like this and can't possibly replace what they're losing, they become tired and fatigued. It's called anemia. And this chronic anemia, where they're tired and fatigued, and sex is exercise. So here's a woman who's chronically fatigued. She's bleeding, a lot. And so she doesn't know when that's going to happen. She's got to wear diapers, even though she's a supermodel. She doesn't feel sexy. She's tired all the time. She doesn't feel like engaging in sex, because that's exercise. It's all that she can do to just push through the day. So from Peter's standpoint, Peter's thinking, Cynthia doesn't love me, which was couldn't be farther from the truth. But they weren't communicating,
Right.
which is really important. So
Yes.
Peter's thinking, oh, I'm not getting mine, so she must not love me. Cynthia's just like, she's focused on, I got to deal with this ridiculous fibroid situation. I'm trying to keep up my empire going, and I'm like worn out as hell. Like, how do I do that? I can't even think about sex with Peter. And so that's where it almost came to the end. Well, she saw us at the Atlanta Fibroid Center. We did a UFE procedure. On a Friday, she was back doing Bravo shoots that following Monday. 3 days later, she was 3 days. Friday, Monday, she was back in the game doing what she had to do. And not only did all the heavy periods stop, the pain stopped, all of her symptoms resolved, boosted up her energy, and she resumed relations again. In fact, she told me fondly, I gave her sexy back. So
Welcome back, sexy.
right. So it's like Caddyshack, Bill Murray, like he goes, the Dalai Lama.
Yeah.
There will be no money, but on your deathbed, you will get eternal consciousness. So I got that going for me. So I gave Cynthia Bailey her sexy back. I got that going for me.
That's
awesome.
good. That's
Well, look-
good.
well, look,
So the answer to that question is yes, it can affect.
Absolutely. It saved their marriage for the time being, and they resumed relations, and everything was normal again.
That's
Okay.
awesome.
Well, check this out. I gotta ask this question. Right? Is it true that some mistake the fibroid pressure for G-spot stimulation?
Well, fibroids cause symptoms based on where they're located in the uterus. So if you had a fibroid that's located near the cervix, it can press on the cervix. Usually it causes a lot of pain because these fibroids are rock hard, they're firm.
Okay.
And so some men can feel their woman's fibroids during intercourse.
Yes.
It's usually painful.
Yes, it is.
For the woman. It can be odd feeling for the man.
It is hard.
And so,
No, I have felt them.
yeah.
No, I have felt
Yeah.
them.
You felt them.
Yeah, they're hard.
Yeah,
They're
right.
hard, and it's very uncomfortable.
Yeah.
You know,
Wow.
I felt them because in a few different women who had them, and even if you put your hand in there and you go in that deep, you can feel them. This like, you can feel them.
Well, I got a question. So the folks that watch our shows, this is this Sugar Daddies. So, we talk about from a range of things, right? And most of the I guess the demographic of individuals who tune in, they want their body snatched, they want to look good, they want BBLs, all those, especially here in Atlanta.
Right.
Right. So Dr. Lipman, talk about having this procedure, or having fibroids without having a procedure, rather, having fibroids. How does that affect a woman's, the pooch area, the stomach? Talk a little bit about that.
It affects it very much because, again, these tumors are hard and firm and they grow in the uterus. And so it will enlarge the uterus, and the uterus will be described as a certain size pregnancy. So that's usually one of the ways that a woman knows that she has fibroids. She starts to feel these things because she's soft, but these tumors are rock hard. So it's kind of easy to feel where they are. And as the uterus enlarges, it starts pooching them out, making them look pregnant. In fact, we see a lot of our patients have, run across somebody and said, "Oh, hey, how you doing? Oh, when's the baby due?" And that's bad for both parties because you can't walk that back.
Right. Right.
The person who says that feels bad because she says, "Well, I'm not pregnant." Oof, it's fibroids. And so fibroids can make you look pregnant. And, we've seen a number of, in fact, I saw a bodybuilder recently, very low body fat. And, no matter, she could do 1,000 sit-ups a day like Nelly, this pooch ain't going away until those fibroids are fixed.
Right.
What happens if it doesn't get fixed? Like if it goes untreated, Doc, what happens?
Well, if you don't have any symptoms, you don't have to treat fibroids. So it's the number one reason why women have heavy periods. As we mentioned earlier, they cause pain. They can sit on the bladder and cause urinary frequency and wake up women at night. So they may pass their husbands who's got the prostate condition like 2 ships in the night.
Okay.
They're both going to the bathroom, waking up multiple times a night. It can cause painful intercourse, as we mentioned. Fibroids that are in the back of the uterus can press on the colon to cause low back, buttock pain, constipation. So wherever they're located, they can cause symptoms. But if she doesn't have any symptoms at all, technically she doesn't need to do anything about them.
Awesome. Okay.
Yeah, so I'm thinking about something that Doc said earlier, and in my mind, if it's only $18-19 million a year going into research, and that's what you said,
Yep.
and you got 30 million women who have been diagnosed, or we know from statistics that this exists in women. To me, it sounds like it's more of a money play. That you want to keep women, particularly black women, sick or with the condition, where you give more research, more money for research for other races of people or nationalities of people for a condition that's less with 30,000 women. So when I say that, I'm just...
Well, hysterectomy is big business. Hysterectomy in this country is a multi-billion-dollar industry. And so imagine, hysterectomy is the second most common surgery done in the United States. Yet nobody at this table and half the population doesn't even have a uterus. But it's the number 2 surgery done in the United States.
Oh my God.
And it's most commonly done for these benign tumors in young black women. So the question then becomes, why are we doing essentially an amputation on young black women for benign disease? This isn't cancer.
Right.
So why are we doing that? So,
yes.
So it's a very, they say number 2 surgery done in the United States, and these are young women.
Right.
And so it's something that is completely unnecessary. And now you have a procedure that takes 30 minutes to perform this UFE. Yeah. It's a 30-minute procedure. It's outpatient. They go home the same day with a Band-Aid, keep all your parts, even have children after. It's covered by all medical insurances, and yet nobody knows about it. The gatekeepers of women's health, the gynecologists, for the most part, don't tell patients about UFE. They're surgeons. They want to cut on people. There's a lot of money. Follow the money.
Yeah.
Well, we're on sugar daddies, right? And being on sugar daddies, one of the things that we talk about in a lot of our episodes is everything relationally, right? Relationships, emotions, the emotions that come with that, right? The stressors that come with that. We even talked about in one episode early on about being toxic in the relationships, or, the stressors of especially a sugar daddy, sugar kind of baby relationship, right? So here's my question. From the emotional side of things, can the stress of a relationship or sugar baby, sugar daddy relationship, can the stress of the situation worsen the symptoms of fibroid?
I'm sure it can. Stress definitely affects women's periods, and anything that affects women's periods is going to be additional. We don't know where fibroids come from, but there's all sorts of studies to suggest that stress plays a role in this. And so, yes, any additional stress, I think, will probably affect fibroids, and fibroids can affect relationships, as we talked about.
And that's good for men to understand, because when my first wife suffered from fibroids, which she still does, it would put a strain on our relationship, because I didn't understand why she was in pain. He said, "Man, my fibroids, I want to have sex." Mm-hmm. Okay. Mm-hmm. And she would be in pain. And so I guess me being selfish or uneducated in that area, I didn't know. Right. So it put a whole lot of stress on our relationship from time to time when it came to her being in pain from it.
Yeah. So, right. Just like Peter. Didn't understand it. The communication, the understanding. This is what she's going through. It's real. Yeah. It's not. She's not making this up. Mm-hmm. It's real
for the men.
Right.
For the men.
Right. And so it's important to discuss these issues because there's a way out. And as I say, for Cynthia, she came to Atlanta Fibroid Center and got her fibroids fixed. There was a way out of it, mm-hmm. and then they could get back to doing what they like to do, mm-hmm. and put that stressor aside. They put it behind them in the rearview mirror.
Dr. Lipman, what is the one thing that women that are over 25, what should they be doing to protect their womb?
Well, they got to first off know about fibroids, and people ask me all the time, what can you do to prevent them? Well, if we knew where they came from, it'd be a lot easier to develop, say, a vaccine, or in certain families, because there's a genetic component of this. It runs stronger in certain African-American families, but you can't pick your parents, so you can't do anything about the genetic. But as I mentioned earlier, fibroids are stimulated with estrogen. Now, estrogen is in the food, in the water. It's impossible to avoid all the hormone stimulation you get from the food supply and the water that we drink. But there are certain hormone-rich foods like red meat, non-organic chicken, dairy, that if you can limit or avoid or do workarounds, that's going to help. Estrogen is stored and produced in body fat. One of the reasons why African-American women disproportionately suffer with fibroids is, in general, they have more body fat on them. Yeah. So that's something you can do. And we talk about with patients, if they can try to everybody kind of knows what their ideal body weight number is.
Right.
And as best you can, try to get towards that number.
Right.
If you can get to that number and lose the excess body fat through healthy eating choices, weight loss, exercise, and there are certain beneficial foods like colored fruits and vegetables. The oranges and the yellows, they have compounds in them called flavonoids, which block an important enzyme in estrogen production. So if you can eat more colored fruits and vegetables, avoid the hormone-rich foods, exercise, weight loss, and then the last piece is vitamin D. Vitamin D, it's technically not a vitamin, it's a hormone, but vitamin D is the most powerful growth inhibitor of fibroids that we know of.
Wow.
Now, green tea extract will also do that, but not as good as vitamin D. Vitamin D is number one.
Okay.
And if you have a normal vitamin D level, say you're a young adult, you're a college student, you don't think you have fibroids, you don't have any symptoms. If you have a normal vitamin D level and you keep a healthy, your ideal body weight, you are so much less likely to suffer with fibroids. But unfortunately, only 10% of African American men or women have normal vitamin D. And the darker the pigment of your skin, the harder it is to get adequate vitamin D.
Wow. Ladies and gentlemen, you heard that from Dr. Lipman. Atlanta Fibroid Center. Doc, tell them where can we find? We know Atlanta Fibroid Center, but just tell them where we can find you.
Yeah, I'm the founder and medical director at Atlanta Fibroid Center. We're celebrating our 20th anniversary this year. Thank you.
Congratulations. Yes.
We're going to be at MCK in September, so people can look for the event.
We gotta go.
Hopefully it's going to be sold out.
Sure.
All the proceeds of the event will go to Hosea Helps Feed the Hungry,
Okay.
100% of the proceeds. But I've been here in Atlanta since 1991, but we built our own center, Atlanta Fibroid Center, 20 years ago. And this is my life's work. I don't do anything else. I care for women suffering with fibroids with this amazing UFE procedure.
Yeah.
It's one of the biggest breakthroughs for women. I'd put it up there in terms of significance to women and their men with the mammogram and the pap smear. I mean, it's right up there. Mount Rushmore of significant medical stuff for women. UFE is up there. They can find me all sorts of ways. We have a website, atlii.com. It stands for Atlanta Interventional Institute. It's the parent company of Atlanta Fibroid Center. So atlii.com. We have an Instagram page. We just broke through the 10,000 follower barrier, which is a lot for a physician, medical, not like you guys. But that's DR_ my last name, DR_LIPMAN. We have LinkedIn, Atlanta Fibroid Center. We have a YouTube channel. It's free. Atlanta Fibroid Center on YouTube. They can actually watch me do an entire UFE procedure, start to finish, and it's not gory because there's no surgery, there's no cutting. It's very easy to watch, and it's not gross like pimple popper. It's very simple and easy. It's a 30-minute procedure, so the video is like 36 minutes because I'm talking as I'm doing the procedure, so they can see step by step how simple it is.
Wow, that's awesome. So, Dr. Lipman, before we get out of here, how's the procedure actually done? You talked about going home with a Band-Aid. Talk a little bit about the procedure.
Well, a patient will come into our center and they get put on an x-ray table because the procedure is done under x-ray guidance.
Okay.
And say it's a 30-minute procedure. The access point is the top of the right leg where your leg meets your torso. There's a crease. If you push down, you can feel your own pulse. That's the artery that we enter. So we enter the artery and I can negotiate a little tiny catheter like a piece of spaghetti. And there's a uterine artery on each side, and that supplies the blood supply to the uterus and the fibroids that are in the uterus. So one at a time, so we'll go into the main uterine artery, and that's like a big tree with a little tiny catheter. And I can flow direct these tiny particles to block the blood flow to all the fibroids in the uterus. So as the main uterine artery branches, it gets smaller and smaller and smaller, like a tree. The fibroids are the leaves of the tree, and I know what size those small, tiny peripheral branches are, and I can plug them up. Without a blood flow, those fibroids will immediately start to die, and as they die, they soften and shrink. The big trunk and the main branches of the uterus, they're open, so the uterus stays alive, and I've had numerous children after UFE, but all the fibroids are dead. And as I say, they die, they soften, kind of shrivel up, kind of going grape to raisin kind of thing. Just like what happens when a woman goes into menopause. Naturally, when she goes into menopause, they die off and shrivel up naturally. We're just not waiting for that to occur. We're making it happen ahead of time.
Yeah.
So it doesn't matter how big the fibroid is.
No, it really doesn't. I mean, we see some pretty big fibroids.
I said that, Doc, that's because my first kid's mother, they took a 9-pound tumor out of her.
Yeah. Fibroids can get melon size. They can get really big. Now, when they get melon size, our procedure can be used, but we realize that they're probably going to need surgery. But cutting off the blood supply to a big melon-sized tumor like that will be helpful for the woman and the surgeon, because devoid of its blood supply, it's a lot easier to handle and get out.
Yeah.
But the vast majority of women can have big fibroids, which all they need is a UFE procedure. They don't need anything else.
Right.
But in these extreme cases, we will work with the gynecologist to make it an easier surgery for them.
Absolutely.
That's amazing. For real.
Just to know that a woman has another option other than getting a hysterectomy.
No,
Right.
that's
Because that's all I ever heard.
That's all we ever heard.
Surgery.
And that's
I got to
all-
get a hysterectomy.
Yeah.
That's
I agree.
all that you will get told. Most gynecologists won't mention UFE, even though they all know about it. It's been around for a long time. Even their society back in 2008 endorsed it as a safe and effective procedure for women with fibroids. And that's 17 years ago. Their organization endorsed it. And so it's been around a long time. Everybody knows about it, but they're surgeons and they want to operate. And even though a woman's entitled to know all her options,
Yeah.
she won't necessarily receive them. So she's got to educate herself. The men in her life got to know this. I'll have women say, when I ask them, how did you find me? Were you referred by your gynecologist? Oh, no. My boyfriend told me, or my husband told me. He researched it and he found you. So it's important for the men in women's lives to know about this, because if you only know one option, you can't make an informed decision.
So let me ask you this question, Doc. Is this education brought to medical students getting ready to graduate?
Absolutely. I mean, we see, I am a volunteer professor at Morehouse School of Medicine in the Department of OBGYN, and I'll see medical students, I'll see residents, I'll even see some attending physicians come and spend the morning, spend the day with us, spend time in our clinic, just to see what this UFE is all about, because it is one of the biggest medical breakthroughs for women, and it's important for physicians. They turn out a lot of primary care physicians that work out in the community, and a lot of them do routine GYN work. It's important to know that these non-surgical options are available, and they've embraced them.
That's awesome. That is amazing.
Well, Doc, we do appreciate you coming on, but we do one thing on our show that I want you to answer this time. We do something called sweet or sour.
Okay.
And what it means is, if it's sweet, that means, you know what? You appreciate that you're with it, right?
You rock
you
with
talk
it.
about why it's sweet. If it's sour, you don't. You just talk about why, right? So, is it sweet or sour for women over 25 to start getting checked for fibroids?
Ooh, that's a tough one, because I'd say if I had to choose one of them, I'd say sour, because you don't have to get routinely checked for it unless you're having symptoms. Because if you routinely check, you might find them, but what's the significance of, it's important to know the information, but if you're having symptoms, absolutely get it checked. If you're having heavy bleeding, and sometimes women bleed heavily and they don't realize that that's not normal. Just because you've been doing it a long time doesn't make it normal. So I tell women, if you're bleeding heavily such it affects your quality of life in any way, it doesn't matter what your hemoglobin level is. It doesn't matter, but anything else doesn't matter. If it affects your quality of life, then you should get it checked, because the most common reason is fibroids. But if they're just totally asymptomatic, nothing's bothering them, they're good, I don't think necessarily you have to look for it.
Awesome. Well, you heard it first from Dr. Lipman. That's sour. So,
He say sour.
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 Don't
says
ignore
sour.
the symptoms. That's the
Right.
biggest thing.
Right,
Don't ignore
exactly.
the symptoms. Go get checked. Dr. Lipman, thank you so much for coming on the Sugar Daddies podcast. We really
Thank you.
deeply appreciate you.
Absolutely. Absolutely.
Hey, listen, follow, subscribe, click the subscribe button. We're trying to get to that 10,000 mark too. Dr. Lipman. Subscribe for us. Let us know what you want us to talk about. Come in our DMs like you always do. We appreciate you. And again, Sugar Daddies, real talk.
Real connections.